This is the gait assessment for patient 1. I'll just let it play through. If we're starting from the upper body, we can certainly see a increased torso rotation, so we're seeing that the arms are crossing the midline of the body. We're also seeing this playing out a little bit lower down in the hips, so there's a little bit of hip pelvic rotation as well as some hip drop happening. If we just have a bit of a slow it down, we can see in that position there the hips are not only rolling downwards, they're tending to rotate downward and forward, and similarly on the other side we're seeing this happening a little bit more, so we're seeing that hip drop and then it heading down forward. There's certainly been some instability detected in the initial assessment anyway. There was a limb length difference with the left being longer than the right. We can probably see that happening with the left foot contacting a little bit more of a midfoot strike, and obviously we tend to expect to be a little bit more forefoot orientated when running on a treadmill. And if we compare to the right, we can see much more of a heel strike contact, and that's pretty normal with a limb length discrepancy. In terms of the knee and foot position, if we have a look at the rear posterior view, we can see knee position's quite good. So we're seeing minimal hip adduction. We're seeing a little bit of rear foot pronation through there, and this is a little bit more prominent than the left. So if we compare to the left, we're seeing a lot less of that. In fact, very little through there. And again, if we zoom out, we can see that the hip adduction is very minimal. So overall, mechanics are very good in this patient. What can certainly be improved, and where he's been referred on to, is to work on some glute stability and control and awareness, and then what we can do is we can track that. So we can, after a few weeks of doing some glute strengthening exercises, we can then follow that up, have a look at running again, and make sure that that's being transferred into running gait. So at this stage, all that we did was a shoe change, so changed from a relatively low profile shoe into a shoe with just a little bit more support, which was a Mizuno Inspire, so it's not a very supported shoe. And at this stage he's having no problems with running and is back training for a marathon.